Good afternoon and welcome to Privacy Security Spotlight with St. Luke's Cornwall Hospital VP and CIO Cletis Earle. Today we're going to talk about penetration testing and the next big challenge of medical device threats. This is a complimentary webinar from healthsystemcio.com and we're sponsored by Redspin, an Auxilio company today. So a little housekeeping before we get started. My name is Anthony Guerra. I'm the editor-in-chief of healthsystemcio.com, and I'll be your moderator today. We're encouraging you to ask questions. You can type them in at any time. Send them in by putting them in the Q&A box in the lower right hand of your screen and leaving the default set to all panelists. You can download the deck using the URL on your screen. I'll also send it out in the chat box, and there's a shortened URL at the bottom of all the slides. And we are recording today's event, and we'll post that to our YouTube channel within 48 hours, usually sooner. You'll get an email when it's ready. So this is how we're going to spend our time today. We're going to go about 45 minutes. First, we're going to hear from Cletis Earle. Then we're going to hear from our sponsor, represented by Dan Berger, president at Redspin, which is an Auxilio company. And then we're going to have our Q&A. So without further delay, I'm going to turn it over to our good friend, Cletis Earle. Cletis, thanks for joining us today.
Good morning, good afternoon. Thank you, Anthony. I say good morning, good afternoon, depending where you are in the world in this conference. I welcome you. One of the first things I would like to do, I always love to stay where Anthony, where I'm not proficient. I'm not proficient with my own schedule and handling my own schedule. So with that, when I did set up this conference call, I didn't have an administrative coordinator, and I booked this while I actually was on vacation. And I'm actually down in beautiful Huatulco, Mexico, right now as I give this conference. But I do understand where I'm from, St. Luke's Cornwall Hospital. It may be a little rainy up there. So wherever you are in the world, I appreciate it. Interesting enough that, we talked about where we're located, and we're talking about security testing and all of these things. One of the challenges when I came down here, I noticed that try to connect, and I realized that I was having a lot of problems connecting, and I wondered, was it the security initiatives we put in place? I think it does. It's interesting when you go to different countries and you try to, look back, you don't know if it's your IPSs that you put in place or any other initiatives that how it impacts you as far as security. So I had to work out with my team and making sure I was connected not only to, the rest of the world so I can get onto this conference, but, to my hospital system. Again, my hospital system didn't allow it. So that was actually pretty good, but if I have people traveling or, other types of customers elsewhere, that's going to be a problem as we move forward. So what I'm here talking about today is penetration testing and the next big challenge of medical device threats. And I wanted to share a disclaimer with everybody, and that, making sure that everybody knows that over a course of several months, I hired a company to conduct the penetration testing of our network. The vendor comprised of world-class ethical hackers that perform various techniques at breaking into our network. Testing of all medical devices at no point put patient care or data in jeopardy. Patient care devices were tested on separate duplicate control networks with emulated security settings. So we were very cautious on how we addressed this problem because, the problem was identified, and I'll go and get into it in 2 seconds. About a year ago, I had this process as we were seeing a lot of vulnerabilities coming through, throughout, it was in the news, and I got concerned, and, I had this really crazy thought, and the thought was, what if, terrorist groups basically got into our network and, had the ability to, we know that they could get into our network no matter what kind of initiative we put in place. I mean, we try our best. But if they got into our network, what was the possibility of some type of terrorist organization to, collectively attack us without getting on the plane or, lighting a bomb? And I don't think anybody likes bombs anymore. But, I thought that we may be compromised or vulnerable from a perspective. And I wanted to do some due diligence in finding out what did that mean. My concern was, again, people coming into our network, and we have a significant amount of medical devices. Was really concerned more of was our smart pumps, and anybody doesn't know what a smart pump is, a medication distribution pump that most of the time sits on your wireless network. And, whether they're wireless networks that are independent or so, it's there. So I looked at, different methodologies of trying to figure out if my theory was correct and how vulnerable we'd be. So again, this is about a year ago this initiative went into place, and I had to find the right partners to partner with and to come in and figure out where we are and where we stand as an assessment. But in the meantime, when you're talking about network security assessments, there's a significant amount of initiatives that we as CIOs throughout the organization, throughout the industry, down to adhere to. So one of the regulatory requirements, is meaningful use. For meaningful use in stage 1, stage 2, and then stage 3 is coming up. There's more restrictive requirements for organizations to abide by. So in essence, creating penetration testing, doing other types of security enhancements. And if you're a healthcare organization, you should know that part of your testing is, ensuring that your organization is, to be meaningful use, you're secure from that perspective. Cyber insurance, this cyber insurance requirement has the ability to say, what have you done for security hacking, cyber fraud and cyber attacks, and having those particular pieces in place, or actually testing out, ensuring that you have a solidified organization to ensure that your cyber insurance policy is not null and void. Auditing requirements, we have companies like Ernst & Young come in, and then they audit us, and for each audit, you're required to show what you've been able to do as far as penetration testing or any type of security enhancement. And the new most wired requirement, as recent, last 2015 most wired, time has coupled in with HHN to basically have security as a forefront. And again, those are other things. If you basically took the most wired survey, you saw network security was at the forefront of the requirement for most wired. And I have to say, I'm very happy that our organization, we not only got the 2014 most wired, but we were able to get the new 2015 most wired hospital. So we're very excited about that. So it goes to show that we are, even with all of the things that we are going to show, we're still in line with some of the requirements that you see, whether they're NIST and other types of standards that are being mandated throughout the country. Security and infrastructure audit. So as I mentioned, we reached out to a company to look at our organization and to do some penetration testing. Some of the audits consisted of 3 possible scenarios. The network emission control, in essence, that was the ability to have see how vulnerable we are from the network side, from the whether it's the systems, whether it's the architecture that we have set up. There's a significant amount of threats that come to the organization. So these are external threats. As they try to come after our servers, our network switches, all of those vulnerabilities, the network emission control testing really went after that. And with the report that came back from this network emissions control, it was very interesting to know that we every year we've actually did penetration testing for the last several years since I've gotten that thing in Cornwall. But even one year you remediate and you make sure that you're good and you've made those vulnerabilities whole. It's just interesting to know that every year something else comes up and something else is identified. And I think that tantamount to the devices that you have in your infrastructure and how well the manufacturers are doing to plug some of those holes. Windows 2 and 3, as you know, end of life, Windows XP, all of these particular things. As we move forward with support and in operations, those devices become end of life and the support, and they then create significant holes. We were okay there. There was things that we found with the network emissions control testing, and I think this is a ongoing piece where we're going to have to continuously, patch the holes as they are identified. And again, this is something that we're going to have to live with for probably the rest of our lives. Wireless emission control testing, that was another scenario as far as audit and infrastructure testing. That is something that I considered more challenged because we had somebody come to our organization and sit in our whether it was our cafeteria or in our parking lot, and find out exactly what's wrong with our wireless, side. How vulnerable are we when it comes to that particular level? And the wireless admission testing, control testing, by far was one of the most alarming scenarios. We found that there was a significant amount of holes there, and I'll get into it in 2 seconds. The medical device assessment, that one, and what my original thought was, come in and have these same type of ethical hackers sit in our network and, try to attack our smart pumps, because that was my initial initiative, which is going after smart pumps. But we also put, EKG, mobile EKG solutions on there, as well as our radiology X-ray machines on that network to basically attack it and see what would come out of it. So we wanted to, we approached this in 2 pieces as far as the 3 types of attack thresholds. And we look at it as, all right, who's hacking? We approach the testing in 3 points to keep in mind. You have your beginning hacker. The hacker basically is one who just picked up the sport, and I mentioned sport because I believe some people feel it is, because they get no financial benefit out of it. They just do it for the sense of the adrenaline rush. And it, we don't consider a hacker a great threat to the organization. You look at it as sometimes kids, whether it's a 10-year-old or a teenager who wants to cause chaos and can learn much of the trade from forums and online videos. For the most part, the beginning hackers, we feel confident that our organization's network security threshold is, will protect us against these type of hackers, because, it's a significant amount of layering we put into place that would thwart some of their efforts that they would get, from just basically the trade. Then you have a medium hacker, and again, these are not the definitions. I'm just trying to outline who we are. But the medium hackers is one who has access to equipment and skills that may be considered more seasoned. They are generally trained and can get past common security measures. So the medium hacker is somebody that we don't consider an absolute expert, but somebody that has access tools, and they've taken the next step of being a beginning hacker. And those are the types of, we were really interested in preventing or looking at our vector, the attack vectors that are associated to that medium grade hacker, and see how vulnerable we are to those folks, because that's ones that we will most likely encounter on a day-to-day basis. And that's something that, again, our threshold who was hacking us and we thought would be hacking us. Then you have your advanced hacker, and this can be state-sponsored or highly advanced organized crime networks. In essence, hackers that, if you've heard Anonymous and all the other types of organizations that are out there, not saying Anonymous is a crime network, but in essence, anybody who really wants to get into your network and they're a seasoned pro, they would have no problem. I'll give an example with Russia. If you heard the latest news, Russia getting into our department of, our military or our files, there's nothing that we're going to be able to do, and we've identified as an organization that has only a few network security specialists going to prevent us from getting in, preventing advanced hacker threats, because they're going to always be ahead of us, and they have a lot of money, they get paid a lot of dollars, as well as they have the high skill set and a countless amount of time to basically get into our data. So again, our threshold that we went after was the medium grade hacker. All right, next slide. So going to the network emission control, the standard attack vectors were launched to determine the level of vulnerability of our organization. These are general network emission control testing that you would see. As I mentioned earlier, the results were relatively mixed. In several cases, we did very well. In others, we found holes. I wanted to note that the tests were done, similarly, a couple of years ago or last year, and we found the new holes occurred. I mentioned this a little while ago, but again, I just outlined it in this particular slide because it just seems that no matter what we do, we're always going to have to be on our toes, and we have to continue to ask our executives, team and on boards to support our security efforts, because this is a new imperative. So we really, as CIOs, we have to push our organization to actively be involved in network security and security as a whole, because this is the new norm. And going into wireless admission control, determining, this particular test vector, we determined the most likely attacker skills were going to be a zero-day attack method. Once we see these are things that we wouldn't know and it's not necessarily widely made available, various resource deployed throughout the organization or over several months to emulate the scenario. We basically, again, with our organization that we use, which is Perimeter Watch, we deployed bots, crypto bots. We employed various other tools to see exactly what's going on. We didn't let our network team, we didn't make them aware of what we were doing, because we wanted to make it anonymous to help emulate a scenario as far as from an attack vector. In some scenarios, we did see that our tools, our security tools, did thwart the effort, but in other areas it didn't. So that was very interesting. But some of the pieces that, in essence, came in, and I have them bulleted out here, is resources scan the networks and frequencies. We had, as I said earlier, we had one of our hackers come in and basically sit in our cafeteria or sit in our public lobbies and put up some tools. And what they ended up doing was pulling up common hardware tools that you can get called Pineapple, and it basically spoofs SSIDs. And this was the scary part of everything. They scanned the network by using these tools, and they were able to identify the SSIDs that we were using. And by flooding those SSIDs, they basically, did a denial of service attack to those SSIDs, and they emulated those names, those account names. And then as people who are originally logged onto those devices, they basically tried to connect to those devices as with the new name that was created, and they created this man in the middle. They basically acted as if they were our SSIDs. And when that occurred, people constantly didn't know. They dropped off the network, and then now they would go back in, and they would put in their username and their password and their credentials. And voila, what would happen is the man-in-the-middle attack would now have all the credentials to our network security access. Now, granted, depending on what type of tier that person came in, whether it was a physician which had certain VLAN credentials or it was an employee or whatever it was, that hacker now had access to that network. And once they had access to the network of being the man in the middle, they basically used the credentials and used the access to now bring up other tools. And this is a very interesting and, again, eye-opening scenario, which was relatively easy and quick. It didn't take a long time for them to perform this man-in-the-middle attack, and it was the success was alarming. So what we did was we identified various holes in the wireless network with relatively simple tactics. We determined additional advanced security protocols would be necessary as an organization, and additional education training methods were required on both IT staff and organizations. Why I mentioned the IT staff, there were scenarios where, we need to train our employees that if they realize that they get kicked off the network, don't continuously try to re-log on. That's a significant amount of training, and if our staff members are called with, our help desk, our service delivery desk is called with a problem, we need to be able to answer and try to help identify when some of these attacks, vector attacks are occurring. So it was again, a truly eye-opening scenario from the wireless admissions control testing. Again, relatively quickly being able to log on to our network device and have at our entire infrastructure. So that was the wireless device was an actual way of seeing how quickly you're able to now go to the next piece, which was what I was really interested in, medical device assessment and all the vulnerabilities. So with having access to our network, which I just explained to you from our wireless, threshold, they now had the ability to look at our medical devices. And what we had on our network, this rogue network that we established was some smart pumps, X-ray machines, EKG machines, and as you can see, any other device. And down here on each bullet item, there was a quick determination as far as what it was: a denial of service, crash device, active hard code password, and from the various types of devices, whether it's smart pump, X-ray, or EKG machine. These are the type of things we were able to do for each device. Now, why I thought it was interesting, because even though the smart pumps was our main target, which was my main target, by having these other devices on the network, which is the X-ray machines and EKG machines, it was easy to see and identify that various devices have the same flaw or have the same level of concern as far as vulnerabilities. And it goes to show how big the concern is, not just for the smart pumps, but for any particular device that we have on our network. And for the most part, when you have a manufacturer come in, they would tell you, yeah, we're fine. We go on our own private network, individual network, and we should be good. But at the end of the day, once you are on a network, D-line or not, that somebody who has advanced or middle grade accessibilities from the hacking, or some type of cyber threat skills, they're able to hop on to the other aspects of the network. So what we ended up doing for these particular smart pumps and these other devices, we created a basic Smurf Attack. And Smurf Attack is just I'll cover it from the bullets. Using pre-configured exploit kits, the attack was successful on all medical devices in the test environment. It stopped all wireless communication, and that was huge, because again, if we're able to crash the wireless communication, that says a significant thing as far as the impact to our organization if this was a threat to the overall system. And we identified the potential weakness by detecting 100,000 SIM packets, each 120K in size, to a targeted device. And that basically flooded them in 15 minutes or less. In many cases, it was 5 minutes. Those packets flooded the device and crashed it. So again, I like to think of, in a medium-sized organization like myself, we're about a 350-bed. So if those devices were crashed, from a flood, yeah, we can get over. We can go ahead and try to identify which devices and try to remediate. But can you imagine if you're a 1,000-bed hospital or any mega organization where you just crashed a bunch of devices? Now you require a reboot, or you have to remediate and identify all of those devices and what happened. And in that time, patient care is being impacted. So the key here is, the threat vectors based on a basic Smurf Attack was able to crash, our devices relatively easy with a huge concern. And several of the devices were able to be crashed, which required a physical reboot. So although they could come back up, that would require remediation, as well as going out to all of the devices throughout your organization and reboot. That time, in essence, can cause lives, and safety to our patients, which is a great concern. We discussed open ports on the devices, on many of them, and once connected, we were able to exploit those devices, in essence, creating, opening and closing the ports significantly over a course of time, was able to crash many of these devices, which was, in essence, a major concern. Large brute force attack was required to guess the administrator or root password. Again, major vulnerability that was identified, and in many cases, these passwords are hard-coded into these units. And as you may know, a lot of the manufacturers, whether it's medical organizations or manufacturers, dial in to support devices. And by having the administrator password on the device itself makes it very simple and very easy to support them. But by doing that, has created a major hole or major gap in our repertoire of our devices. So that's a major concern. And, the brute force attack, although you can simply go out there and do a Google, because many of those devices have the information already loaded on them, you would be able to find some of the passwords. And we found that these kind of attacks were not just for the devices that we had, but for other devices, other manufacturers that are out there, so which remains significant. So no one thought is unique, and it was very interesting to, after we did this, we went out there and we looked at what other type of white paper was out there on this case, and we found that another couple of users out there had a very similar thought process about a year ago, right when we started this process. And Billy Rios and Jeremy Richards had a similar thought and reached out to, they were actually looking at the Hospira device. And from the Hospira device, they did something very similar. But in their scenario, they were not only just able to crash the device, but they were able to change the dosage on the unit. So can you imagine you're again, some type of hacker being able to inject themselves into your network and change the dosage on, some of our patients, our medication dosage, and potentially cause a significant amount of harm to our patients. So Billy Rios and Jeremy Richards actually did a very similar initiative, and they reached out in May 2014 to the FDA and Homeland Security to help push, the issue. They actually reached out to the manufacturer first and seeing if the manufacturer would do something about it. They didn't originally, and they went ahead and basically marketed, or I should say, released their findings on the white paper. And the fourth bullet down, which is xsniper.com blog, was some of the information of the findings on that particular device. And it just goes to show that, you really have to aggressively pursue these manufacturers to ensure that they stand up. Because at that point, the manufacturer refused to move ahead. But after the white paper was released, the manufacturer has started to change their releases as far as software, and they're now helping to support these devices to plug some of those vulnerabilities. And you'll also see from the cert.gov, you'll see some more findings of that particular user case, and again, it was very interesting from a user. Now, granted, here I am, I'm telling you about security threats, but yet I'm giving you links, to look at. Now, one would be somewhat cautious about it, and I would agree and appreciate your concerns, but there has to be some level of, looking out and seeing what's going on in the going on in the world regarding to threats. And you almost have to take a stand and say, all right, I have to start like a hacker, or Black Hat was last week. How do we remediate, or how do we what's going on in that industry and seeing how it's potentially going to impact us? So I would say that if you see that a .gov address, trust that it is a legitimate address. Go out there and see what's going on. The Wired.com article also tells you some more information regarding that particular scenario. And with that said, I have a lot more, but with the sake of time, I would just love to talk about this in the question and answer if we have any other questions associated with it. But with that, Anthony, I'll send it back to you.
All right, Cletis, thank you so much. That was an excellent presentation. I'm looking forward to the Q&A. So with that, now we're going to hear from Dan Berger, who's sponsoring this event. He's the president of Redspin, which was recently acquired by Auxilio, which I believe Dan will get into a little bit. So Dan, thanks for joining us, and thanks for sponsoring.
Thank you very much, and it's a pleasure to be here. I'll try to keep this brief. This is the 5-minute commercial break here. So let's tell you a little bit about Redspin. Redspin is one of those companies similar to what Cletis mentioned. We are a group of ethical hackers who conduct penetration testing all the time. In fact, virtually every week we're doing a pen test of some sort. In the past 5 years, we've really focused almost at least 50%, if not more, of our business on the healthcare industry. And we were recently acquired by Auxilio last April. So we go back a long way. We've been doing this for a long time. We've got 15 years experience. We were founded in 2001. We conducted thousands of security assessments for hundreds of organizations. Our team is a world-class team of IT security engineers and compliance consultants, and we test a lot of different things. We test networks, applications, policies, processes, and people. As I mentioned in the opening remarks, we are primarily focused on helping the healthcare industry. We do have other business with mid to large-sized companies and some name brand or brand name clients in the Fortune 1000. We were acquired by Auxilio in 2015 primarily because of our footprint in the healthcare industry. Auxilio is a managed print services company focused exclusively on hospitals, and they're diversifying their business into IT security. They looked around for a company that was well-known, established, and had a significant client base in the healthcare industry because it would be helpful to their current base as well as be able to expand kind of our client bases in both directions. With that acquisition, we were also able to add vulnerability management, incident response, forensics, and security program development consulting services due to a prior acquisition that Auxilio made earlier, about a year earlier. So I'm starting off with HIPAA security risk assessment because it's one of the things we do the most of, and then I'll get into penetration testing. So we believe we're the undisputed leader in the healthcare market. We've done over 135 hospital clients and nearly 1,000 clinics, many large business associates, all for the HIPAA security risk assessment scope of work. Oftentimes that's driven by needing to use, sometimes more often by just the fact that it's required by HIPAA, and sometimes you'll also hear that people are concerned about an OCR audit, so that they want to make sure their ducks are in a row when it comes to the HIPAA security audit. The thing that differentiated us right from the start was that we were an IT security company long before the HITECH Act. And so when we approached the HIPAA security risk assessment, we were laser focused on safeguarding protected health information. We don't sell product or a service company only. Very technically focused. We don't outsource any of our work. All of our compliance consultants and security engineers are employees. And we started off right out of the gate saying that in order to really fulfill the obligations of HIPAA, you can't just look at the compliance standards. You've got to actually test the network. So we've been doing vulnerability testing and penetration testing, wireless, and the like as part of our HIPAA risk assessment engagements right from the start. Our scope of work meets HIPAA, omnibus, meaningful use compliance requirements. As we say, we're battle tested, which it means in our case that we've helped our clients through audits from both CMS and OCR, and our work has passed with flying colors. We deliver risk-rated findings, expert analysis, and actionable recommendations. But more to the point of this particular webinar, we are more well-known than anything else in the world as a penetration testing company. If you Google penetration testing, you'll find Redspin near the top of the list in terms of organic results, and also we have some advertising behind the word as well. So what penetration testing means to us is that it's us simulating a realistic attack on the network. And we're looking to compromise systems, credentials, network devices, and sensitive data. We've done this for a long time. We've never had a penetration test where we were unable to get in. It's always an interesting situation when someone hires a company to do a penetration test and they say, well, basically we couldn't get in. That's not a good thing. So it tends to challenge the invoice at the end of the day. So we've always been very successful at getting in one shape or form or the other. We also look at vulnerability assessments. So we consider penetration testing to be the depth, looking in depth, and vulnerability assessments to looking at the breadth. So we'll look at all internet-facing services for misconfigurations and vulnerabilities, eliminate false positives, and give you a hybrid report, which is giving you both the breadth of our findings as well as the depth. We'll try to exploit several of those vulnerabilities to get in. What differentiates us from most other vulnerability assessment companies or penetration testing companies is that we do a lot of manual analysis. It's not just running a scan and giving you the results. We're running the scan, we're eliminating false positives, we're actually validating each individual finding that we come up with, and then we're going to try to exploit them. We're vendor neutral. We use the best tool for the job, whether that's a commercial tool or an off-the-shelf commercial tool or an open source tool. And another differentiator with us is we do one-to-one support, which means the actual engineer that does the test is available to you post-testing for any questions, concerns, and follow-up. One of the services we launched most recently, which has been very successful, has been our red team assessment. And how this is really a penetration test on steroids. The red team assessment, we will attempt multiple attack vectors over time. We'll try social engineering through email phishing or even physical socials. We'll do wireless. We'll do external and internal exploits. We'll also look at web application, your public-facing web applications. And we share the knowledge. It's a team-based approach. We share the knowledge, much like a organized hacker group would do. We share that if we find something in social engineering, we share that with the engineer that may be doing the penetration testing from an external vantage point. So we leverage our expertise and resources, and we have the ability to pursue multiple paths. What differentiates this from many other types of pen tests is we truly mimic the kind of expert level that Cletis was talking about. We truly mimic an organized hacker group. We provide you with a narrative report. And these are real hacks. They're not hypotheticals. So one of our taglines is "Don't risk what scanners miss," because we're going to be doing this predominantly using tools to give us a clue to what to look for, but then manually trying to exploit the network. I'll make one comment on medical devices. I noticed in Cletis' presentation he had a disclaimer. It's a very important disclaimer when you talk about medical devices, segment or putting them on a different network, a test network, before you conduct this type of penetration testing. It's very important to do that. We actually, when we do this work, we'll actually, if we're going to do just doing a routine enterprise-wide test, we'll actually exclude those devices from that particular test. And we can test them separately on a properly test network, a proper test network, but we exclude them from the main test. And one of the primary reasons that we do that, and we learned this a long time ago, is that medical devices, although they're networkable, they're on the network, they weren't really, very few of them were actually designed to be a network device. So when Cletis was mentioning that these devices are getting flooded, it's very easy to flood them. Even conducting a vulnerability assessment, a vulnerability scan can flood them. So you can imagine that you could have a rogue server or a rogue workstation just sending packets to the wrong place and bringing down one of your critical devices that's supporting patient care. So I just wanted to reinforce that point. That's it for the commercial, and I'll be happy to stick around for questions. Hand it back to Anthony right now. Thank you.
Thank you, Dan. I think that was a very good presentation, a lot of good information there, both about your company but about the topic overall. So we have a few minutes for Q&A now, so go ahead and send your questions in as they come to you in the Q&A box. Leave the default set to all panelists. Cletis, I want to ask you what, to me, is a very interesting issue around this topic. Okay. Now, if you're a new CIO at an organization, you come in, I would certainly think this is a no-brainer right away, because essentially you're not responsible for what you've taken over, so the results do not, reflect badly on you. Now, if you've been at a place for a while, do you think that some CIOs have some trepidation about ordering a penetration test because they're afraid the results may make them look bad, like, oh my God, you've been here for 5 years and look how exposed we are. So talk about, is that a real dynamic? And obviously that's something that a CIO needs to overcome, but talk a little bit about that.
Well, if you're being audited, you're required to do it year over year. So, and you know, again, with meaningful use, and with all of these other initiatives, regulatory initiatives, you have to do it. You know, Dan said, but all of these things require you to do that now. So I think gone are the days of sitting behind that proverbial desk and waiting, you know, waiting it out. You have to do it if you're going to be in compliance. So I think that kind of answers or addresses that concern, that anybody who is a CIO for a substantial amount of time, you have to do that to remain adherent to whether it's cyber insurance or anything else. Now, going backwards to your first question, you know, coming here a few years ago, I'm only at this organization in the last 4 years, but when I first got here, one of the most alarming that I got, you know, 1 week into, you know, being at the helm, he had a potential breach, you know, and it was, you know, it's very interesting because I didn't know it, you know, when you're you know, they recruit you up and, you know, everybody, hey, these are the things that your organization has, and you're all happy and blah, blah, blah. And you're relatively confident what you're going into from what they presented. But, you know, it's interesting that my experience was the thing that we were potentially vulnerable, nothing to do with, you know, the assessment that was presented to me prior to me taking the job. You know, and I just say that either way, I think that you're, as a CIO, it is your responsibility to take on the act of constantly pushing the envelope, constantly assessing your organization vulnerability, whether it's, you know, whether you do it every 6 months or whether you do it every year. You have to do it because, again, the new norm is that we are required, we're going to be tested by people. I always, anytime I do a presentation, when it comes to, you know, security, I say that you have to think about yourselves as already being compromised. There's a extremely high likelihood that you may have crypto bots on your network or on your domain, and you don't know about it. There's evasion testing. If anybody's aware of evasion, you know, in essence, now what's going on is you can go to multiple websites, and, you know, every part of a website, whether it's MSN, Yahoo, or wherever, you can get a portion of a virus, and then that virus basically comes down onto your domain, and it self-compiles. In essence, you never know. So there's so many things that comes out on year over year, and imagine 2 years from now, we're going to have a whole another litany of different things that, you know, hackers and nefarious organizations are using to actually come after us. So I think it's a working, like a living process that to get used to doing as we move forward. And, excuse me, I'm sorry, go back into the medical data. We have to demand our manufacturers become more up to date regarding how they use their technologies on our domains. It is neglectful at the least from these organizations to make our enterprises vulnerable to that level.
Very good. Excellent. Dan, the next question comes in, seems like it's a good one for you. When performing information security risk assessments for networked medical devices in a hospital, do you have a way to balance security risk with patient safety risk?
Yes, and I think I alluded to that a little bit in my remarks, that we would never test those devices, you know, as part of an overall scan. So we would want to do what Cletis had mentioned earlier. We would want to set up a separate network to test those devices so that we don't interfere with any patient care. One of the things you encounter up front, though, is with other firms besides Redspin who may come in and want to do a vulnerability scan, you also want to make sure that they're not scanning those devices inadvertently, because you may give them an IP range, and included in that are some, you know, some sort of medical device that could actually be taken down. Mostly what we've seen is by buffer overflow, even from a kind of slow vulnerability scan. So yes, we would exclude them from our normal testing, and we would set up a test network for the devices themselves.
Very good. I'm going to sneak in one more quick question here, Cletis, if you would. Funding for testing. Have you had any issues getting the funding you need, and do you anticipate any of your colleagues might get any pushback when requesting funding for penetration testing?
I have, and one of the ways of being successful, you have to be a champion, to the board and to your executive team of exactly how important it is and what's going on. Gone are the days that we put in an infrastructure, we are in essence, relieved of any, threats. But one of the beautiful parts about what helps with funding is the fact that almost every week you're seeing some type of media, report that there's some type of massive breach. And it's almost a self-funding effort. And what I mean by that is a significant amount of board members come up to me or call me or send me an email, hey, what happened to Anthem? Hey, what happened to the federal government? Hey, what happened to Target? How are we, in essence, protected against that? And those are the things that helps us, as senior IT leaders, with the funding conversation. So it's almost it's self-promotion or self-marketing, actually, to security and how we are to move forward with those efforts. So I don't know if maybe 2 years ago, it may have been more of a challenge, 3 years ago, but again, every week, or it seems like every other week, there's something. I actually just saw an email pop up from Chime that HHS now has been held, in essence, some type of breach. Again, it seems like every other day we're seeing, some type of funding marketing initiative that helps our jobs make it a little bit more simpler to pay for these penetration testing.
I think that's the perfect answer. Well, that's about all we had time for today. I want to thank Cletis Earle for giving an excellent presentation. I want to thank Dan Berger and Redspin Auxilio for sponsoring. As I mentioned, we did record today's event. We'll put it on our YouTube channel, and you'll get an email when it's ready. Attending our events gets you one Chime CEU for their CHCIO program. If you've asked us to let Chime know that you've attended, we will. If not, make sure you let Chime know. Sponsorship opportunities for events like these, contact Nancy Wilcox. Questions or comments overall, contact me, and you can go to our website, see our upcoming schedule. So once again, I want to thank Cletis, Dan, and our audience, and everybody have a wonderful day.